It's Brilliant East. My name is Goife. Smash the subscribe button. This is video number 6, Obstetrics and Gynaecology. Question number 51. A 76-year-old woman was admitted to the ward within a 1-week history of diarrhea. She was opening her bowel 4 times a day. She had recently started a new medication. On examination, her temperature was set 6.4 degrees centigrade, pulse was 74 beats per minute, and blood pressure was 164/78 mm of mercury. She had a resting tremor in the right upper limb. Her abdomen was soft with mild generalized tenderness. Which of the following drug is most likely to have caused her diarrhea? The answer is B. Cocaine-dropa. This drug usually causes diarrhea compared to other drugs. Question number 52. A patient at 17 weeks gestation is diagnosed as having an intrauterine fetal demise. She returns to your office 5 weeks later and has not had a miscarriage, although she has had some occasional spotting. This patient is at increasing risk for which of the following? The answer is C. Consumptive coagulopathy with hypofibrinogenemia. This is just similar to DIC, disseminated intravascular coagulopathy. Question number 53. You are an intern on call in gynecological ward and you attend a 26-year-old married woman whose lasting normal menstrual period was 2.5 months ago, developed bleeding, uterine cramp, and passed some tissue per vagina. 2 hours later, she begins to bleed heavily. What is the most likely diagnosis? That is E. Incomplete abortion. As you can see, the passage of tissue per vagina signify and the bleeding. Yeah. Question number 54. A 17-year-old Gravida1/0 woman presents to labor and delivery complaining of contraction at 8 weeks gestation. Her blood pressure at the beginning of pregnancy was 90/60, very low. Anyway, so though this is normal. She has gained 21 kg throughout pregnancy, 4.5 kg in the past 4 weeks. Her blood pressure on presentation was 145/80. That was very high. And a urine dipstick of +1 proteinuria. On examination, her cervix is 3 cm dilated, 90% effaced, and 1 station. What the next step in her management? The answer is A. You give magnesium sulfate because on this patient you are dealing with pre-eclampsia with the temperature of 145/80 on the initial presentation and +1 proteinuria. Question number 55. Mwanahawa is 26-year-old woman, Gravida1/0, present for a prenatal visit at 34 weeks of gestation. She complains of some mild nausea and vomiting over the past 3 days. She has no headache and no visual changes. Her blood pressure is 142/83, has increased mm of mercury. On examination, she has +1 lower extremity pitting edema and +3 reflex bilateral with 4 beads of coroners. A urinary dipstick has +1 protein. The laboratory test result come back with elevated liver function test, low protein, a normal hematocrit, and an elevated LDH. What is her diagnosis? The answer is D, HELP syndrome. HELP is hemolysis, elevated liver enzymes, and low platelets. The blood pressure has increased, and the parameter indicating HELP syndrome. Question number 56. A 25-year-old patient at 32 weeks of amenorrhea was brought to maternity ward. These are the clinical findings on the physical examination. Pale, dehydrated, with the pulse rate of 120 beats per minute. The pulse rate has increased. Blood pressure of 90/60, that is hypotension. Delay in the capillary refill time. Bleeding per mouth. Abdominal exam. Fundal head of 36 cm. Tenderness and hard uterus. No fetal heart. Head. Vaginal, scanty blood coming through the canal. Reddish area around the external cervical os was noticed. Which among the following is the most likely diagnosis? The answer is A. It is vasa previa with intrauterine fetal death. The child has died, and this in vasa previa it is due to a traversation of vessels, the fetal vessels, towards the cervical os. That's why there was a reddish area around the external cervical os was noticed, indicating the blood vessels of the fetus in vasa previa. Question number 57. A 28-year-old Gravida 2 para 1 living 1 woman who is 18 weeks pregnant present to the emergency department increasing left lower extremity swelling, redness and pain. She first noticed the symptoms 2 days ago and has tried elevation and warm compression, which have not helped. She has no personal or family history of blood clots. She is otherwise healthy, and her only medication is prenatal vitamin. In the emergency department, her vital signs are normal. Physical examination is significant for left lower extreme edema, calf tenderness, and erythema. You suspect that she has a lower extremity venous thrombosis, and you plan to start her on anticoagulation therapy. Which of the following is the most important test to confirm your diagnosis? You do, as I say, left lower extremity venous Doppler ultrasound. You need to do this Doppler ultrasound on her lower extremity, not the diameter, because that is the place affected. Question number 58. A 28-year-old Gravida 2 para 1 woman presents to the emergency department with abdominal pain since the past day. She reports a 1-week history of nausea with occasional vomiting. She has noted some breast tenderness as well. She denies dysuria, vaginal bleeding, or any body symptoms. She reports that her last period was 4 weeks ago, but was lighter than normal. She has been using condoms for contraception. On arrival, her vital signs include a temperature of 37 degrees centigrade, blood pressure of 117/68 mm of mercury, pulse rate of 78 beats per minute, and respiratory rate of 16 breaths per minute. Cardiovascular and respiratory examination are normal. She notes some suprapubic abdominal discomfort with palpation, but she does not have the bone tenderness or guarding. There is no signs of peritonitis. A speculum examination reveals a closed cervix without bleeding. A pelvic examination is mildly uncomfortable and reveals a normalized size activated uterus and palpably normal adnexa. A urine pregnancy test is positive. What is the test you should order first? So the answer is C. You should do a quantitative level of beta HCG, human chorionic gonadotrophin hormone. Question number 59. A 31-year-old Gabda1 woman at 39 weeks and 4 days present to labor and delivery unit with regular contraction occurring every 3 to 5 minutes. Her contraction lasts 30 to 90 seconds. She is not sure if she has been leaking any fluid from her vagina. You take her history and conduct a physical examination. Rupture of membrane would be supported by which of the following? The answer is E. When you see during speculum examination with evidence of pooling in the vagina, that will indicate premature rupture of membrane. The gush of fluid indicating prom. Question number 60. A 33-year-old woman at 37 weeks gestation, confirmed by early sonogram, presents with moderate to severe vaginal bleeding and is not by sonogram to have placenta previa. Which of the following is the best management for her? The answer is C. Cesarean section. As you can see, in placenta previa there is an abnormal attachment, and at this moment is 37 weeks term pregnant and there is vaginal bleeding. So the only thing that can save the baby and the mother is cesarean section, not induction of labor or anything. Subscribe, hit the bell sign, like and share my video. It's me, Godfrey Oscar on Brilliant East. You're warmly welcome.